I'm Summer, and I'm going to show you how to actually perform CPR on an adult. First thing you need to do is check your scene and like the scene around the person and see if there is any danger around them. Like make sure if they're are near a fire or on the road, you need to make sure that they are safely away from anything. Then you need to see if the person is unconscious. You need to tap them and ask them if they are okay or if they can cough or anything like that. If they do not respond, then you need to send for help. You need to have someone call 911 and if possible see if someone can get you an AED in case compressions and stuff don't work. Next thing you need to do is check for their pulse, and you can check right here on their carotid artery, and you just say your 2 fingers here, and if you don't feel a pulse, then that's when you need to do CPR. And then you can also check for their breathing, and you can just put your head down here next to their mouth, and you can hear them either coughing or breathing. And if they're doing neither, that's when you need to start it. First thing you need to do is lie the person completely flat on the ground. I'm going to do it up on the table so you can see better. First thing you need to do is place one hand on their breastbone, and you need to intertwine your fingers and put it on top of the other. And you need to put your whole body's weight over top of them so that way you have really good compressions. And then once you go in, you need to go about 2 inches deep into their chest. You do 30 of these. And do more of those. And then, after you have done those, you need to give them 2 rescue breaths. And usually, if you don't have anything to bury yourself, put a barrier in between you and that person's mouth, then that's okay in an emergency situation. But I'm going to use this, and it's made for using on dummies or if you have one available. And what you're going to do is you're going to tilt their head back, and you can use 2 fingers on their chin too to help it back. The reason you do this is so that way, whenever you do that, the airway is open, so that way the air can get all the way down to that person's lungs. So you tilt it back, and you give them 2 rescue breaths. And what you need to look for is you need to look at their chest and see if that rises and falls with them. And you need to repeat compressions and the 2 rescue breaths until they're either conscious or someone comes and they are, like a medical team or something, is there to help them.